The Moon Notice. What is it? What does it do? Why should you care? I am your medical bill whisperer, a previous billing manager turned patient advocate. I offer insight solutions and answers to patients like you. So that Moon Notice. Let's start with background. It is only for Medicare patients. I mean original Medicare or Medicare Advantage members. As a quick reminder, Medicare Advantage is also called Medicare Part C. I have a bunch of videos on the different parts. But Medicare members have rights and protections relating to their financial liabilities. Those rights and protections must be given to members through notices in a timely manner. There are a number of notices. The one today look at is the Medicare Outpatient Observation Notice, also called MOON. This is a notice that hospitals are required to give to Medicare patients to inform them that they are receiving observation services and are not inpatient at that hospital. So what's the difference between inpatient and observation? Inpatient means you have been admitted. That means either you have been there a good 2 midnights and your medical care requires a level that can only be given at that hospital, or that your doctor has ordered such an admission due to the severity, complexity of your medical needs. By contrast, observation status means outpatient. Your medical needs are not that serious enough for you to be admitted, or you're not quite well enough or stable enough to be discharged. You can be under observation if you have gone through the emergency room or just as part of a hospital stay. So usually observation is the time in between not being admitted at all, less than 24 hours, and being admitted, usually after 2 midnights. Why would you be under observation? For short-term treatment, if you need to be assessed, if monitoring is required, if you're not ready to be discharged, if you need a test, a lab, imaging, for example, an MRI, if you need an ER visit or have a minor surgery scheduled, if you, again, are not stabilized enough to be released, if your care is not for life-threatening situations, if you've been there less than 3 midnights. Observations is basically a limbo between outpatient and potentially inpatient. So let's get back to that Moon Notice. What does it do? When you are considered under observation, a Medicare member must be given a notice by the hospital either before services are rendered and you're expected not to be admitted, or because your status changed from having been admitted to observation if your medical care does not require such a high level. Every time your status is considered observation, or within a certain amount of time, you must receive that Moon Notice. So if you were in the ER but have not been admitted yet, are in observation, you should get a notice. Same as if, let's say, you went through the ER, were admitted, but the doctors then decided your situation could just be under observation and did not require you to stay much longer at the hospital. And of course, if you went straight to the hospital to be admitted, but are ready to be discharged, the in-between could be observation. Medicare requires a Moon Notice to include a number of things. The most important is notification that you are under observation and not inpatient, even if you've been there already a couple of days. A medical reason why you are under observation must be given. For example, you are too sick to be discharged home, but not sick enough to stay at the hospital under the inpatient status. And you must sign that form in order to confirm you have received notice and understand the terms. Now, the form should also include who at the hospital can answer your questions. It could also indicate the cost-sharing details, and we'll get into that in a second, and any additional information regarding financial terms or medical details. Now, if you are at the hospital less than 24 hours and have not been admitted, don't expect such a notice. You are already considered outpatient, not under observation. Under observation would be only if a doctor thought you would be there for more than 24 hours, but not being admitted right away. So what does it mean for your wallet? Basically, the MOON form informs you of consequences that could bring bad surprises down the line. Whereas inpatient services are paid by Part A and outpatient services are paid by Part B, observation is paid differently. If you are under observation, then admitted within 3 days, Medicare Part A will pay all of those claims. But if you are just under observation and not admitted, then it is covered under Part B. And that is a huge problem for a number of patients. And the problem, unfortunately, has come to grow over years as more and more patients are left under observation status for longer and longer number of days, resulting in financial hardship. The main one, being paid by Part B, you have a 20% copay. I hope that you have a good secondary coverage to cover that 20% copay. Otherwise, your wallet will feel the pain. But the most important issue about being under observation is if you need to be transferred to a skilled nursing facility after the hospital stay. Why? Because Medicare only covers skilled nursing facility services if you had a 3-day inpatient stay at a hospital, not observation. So even if you have been 3 days under observation at a hospital and are transferred to a skilled nursing facility, Medicare will not cover it. But skilled nursing facility stay, all the charges are going to be at your expense. And that's why the MOON notice is so important. If you receive one, do not ignore it. You may still have time to appeal it or discuss it and change it. But if you sign it, are discharged, and then go to a skilled nursing facility, well, it's going to be really hard to get payment, if at all. And also, those 20% copays can really add up. Now, I will give you some helpful tips to help you along. So again, confirming your status when you are in a hospital is a must. Do not anticipate or expect that you are inpatient just because you spend the night there. Although Medicare recommends that a 2 midnight stay results in an inpatient status, it is not always the case. Your doctor decides. The medical records must confirm that date of admit as it is reported to Medicare and will determine whether Part A or B cover the services, and again, what coverage of a potential skilled nursing facility stay will be. If you have received a MOON notice but have been there 3 midnights, I would definitely grab somebody's attention and have them change that status to inpatient. If you disagree, don't have information, have questions, please grab your doctor, grab someone at the hospital have them discuss the case with you. Why? There are many errors in the billing department reporting the wrong date of admission, especially once it has been changed. And that can lead to heavy negative financial consequences for you. And last, yes, I wish I did not have to say this, but double checking and asking questions is part of the medical process and your best bet to avoid very bad surprises down the line. I so thank you for watching. Your comments, your likes, your subscribes have helped this little channel grow, and I hope to reach out to many more patients like you with your help. So thank you.